Good afternoon, everybody. I'm Sayukta from Vistas Media, your host for today on Here All Issues Are Resolved YouTube channel. We go through a lot of look beautiful related issue as we grow up. But little do we realize that it's our hair that's our crowning glory. Our hair symbolizes health and personality. Gorgeous and healthy hair is an instant confidence boost. To guide us on how to take care of our crowning glory, that is our hair, we have with us an expert dermatologist, Dr. Roma Pandhi, live from Chandigarh. Dr. Roma is MBBS MD, consultant dermatologist at Pandhi Hospital, Chandigarh. She has over 26 years of experience as a dermatologist. Dr. Roma in Chandigarh is one of the most renowned dermatologists. Dr. Roma is known for her command over the field of dermatology and enjoys the reputation of being both skillful and ethical. A very warm welcome to you, Dr. Roma. It's a pleasure to have you with us.
A very good afternoon, Sayukta. And at the outset, I would like to thank IPCA for taking this opportunity, for helping me guide the patients and the people about skincare and understanding their skin types and how to take care of their particular skin types. So, yeah, thanks for that vivid introduction. And Sayukta, yeah, you can please go ahead.
Yes, and Dr. Roma, today we are going to talk about hair. Skin, as we know, is the largest organ of our hair, scalp also included. Now, the thing is that we go through a lot of hair-related issues in our day-to-day life. We all shed hair. That is the most normal thing. We see hair over our pillow, over our t-shirt or shirt, etc. So hair is everywhere, but we many a times miss them on our scalp. So that's a big concern for almost everyone. So today we'll talk about hair. Now, my very first question to you, Dr. Roma, is that, as I just said, that we normally shed hair, but then we don't know what is normal and when to be concerned, when to be, alert, alarmed, and go and consult a dermatologist like you.
So, Sayukta, today we are going to be talking on skin related issues, and skin topic for today would be what are the different skin types, and I would be addressing about our different skin types versus the hair, which I think I have discussed before in my previous YouTube sessions as well. So we need to understand what are our different skin types and how we go about understanding what type of skin we have. So knowing your skin type is very important, and taking care of your skin, the best way possible is to understand the type of skin you are carrying on a regular and day-to-day basis. And the common types of skin are the dry skin, the oily skin, we have a normal skin, we have combination skins, and we have sensitive skins. And somehow the combination skin types are the most common, which is a mix of the oily and dry skins. They are the most commonest type of skin types we see in our practice. Normal skin is also called as a eudermic skin. And this means that it's a very well-balanced skin. There's enough of oil and enough of water, and it's not too oily, not too dry. Oily skin, on the other hand, is a result of excessive sebum production. So we have a lot of oil being produced other than routine, what a routine skin oil, routine skin would make. And so it's not a very balanced or a pH balanced kind of a skin. This is for as far as the oily skin is concerned. Now, the dry skin is a lack of moisture in our skin because we are not making enough oil, or our natural moisturizing factors are not produced as much. So that actually makes our skin more dry than usual. And because of that, of course, we're going to need a supportive care. I will be talking in detail as to how to understand what type of skin you have. But for now, I'm just going to list the type of skins we commonly see. And then, like I said, we have a combination skin, which is wherein we have an oily T-zone, and we have the outer areas of our skin, which are very dry. Right. Then we have a sensitive skin. So sensitive skins, on the other hand, are very intolerant. They're very not very acceptable to products. They are irritated, and there's redness and there's burning. So those that type of skin is the sensitive type of skins. So this is to list the type of skins we carry on an average on our face, or even this could be even true for the body. But today I'm going to be discussing more, highlighting more on the face skin types of face skin, right?
Right.
Okay.
Now, as you just explained what all kind of skin types are there, now as a layman, it becomes difficult for us to understand our skin. We can go to a dermatologist and, of course, take the advice from them, from an expert, and understand our skin type, and then go for the skincare as per the skin type. But if, as a layman, I want to try and test it at home, is it possible? Is there a way?
Absolutely. Yeah. It's as you don't necessarily have to visit a dermatologist. If you could, that would be the best thing. I mean, you would actually get a upfront diagnosis of the kind of skin you have. But in case you cannot and you don't have access to a dermatologist, before you try on any products, you need to understand what kind of skin you have. So there are two methods which can be done at home. One is the blotting sheet method, in which you can take a blotting paper and dab it on your different parts of the face and then hold it against sunlight. So if you see any transparency in any area of or oily patches on the blotting paper in certain areas where you have dabbed, then that shows that your skin in that part of the face is oily. Then we have the other method, which is, so obviously if you don't see any oil spots or transparency on the sheet, means you're generally carrying a normal skin or a dry skin. Then the other method is also called as the just plain faced, or we call it also the bare-faced method. In the bare-faced method, what we advise is that you wash your face with a gentle cleanser, not too harsh and not too this thing, not very mild also, but just a very gentle cleanser, which after which you leave your face to dry for without applying any medicine or creams or anything. Just let it dry, air dry a little, and then you see if you feel for any kind of tightness or you see any dry patches, or even after face wash, if there is any excessive oil on your face, or if there's any kind of irritation or sensitivity. So that will classify. If you don't feel any oil and if you're feeling very dry and stretched out, that means you have a dry skin. If you see a little bit of oil in the center of your T-zone and the dry outsides are still feeling dry, so that means you have a combination skin. If you see a total oil, you feel oil coming up back again even after a face wash, then it classifies you as an oily skin. And sensitivity, like I said, yes, if you have a sensitive skin right after face wash and you see patches and you see redness after your face wash, then means you have a sensitive skin. So these are ways of sitting at home and just, putting yourself in a category of the type of skin you have.
Right. And initially, you also said that it's really important to follow your skincare routine as per your skin type. So if I have oily skin, I need to follow the, skincare routine for oily skin or dry or whatever my skin type is. Now, again, doctor, would you like to shed some more light on how to, what skincare routine to follow for various skin types?
Yeah, so the two methods I mentioned previously were something you could do at home, and also identify yourself into a skin category, particular skin category or type. But then there are ways also when we see the skin, there are certain features which classify you, saying that, okay, if you have this, it's that kind, and if you have this feature, it's that kind. So now I will start with the normal skin. How do you identify your skin as normal? How do you categorize your skin as a normal one? So it'll be a very smooth textured skin. It would have very fine pores, not really opened out pores. There would be no sensitivity. There would be no pigmentation. There would be no breakouts. There would the skin would actually look nice and radiant and glowy and dewy, is what a normal skin would look like. Okay.
Right.
So we call these these features classify you as having a normal skin. Now coming to the oily skin, it's I don't think it really needs any for any explanation. The skin just looks full of oil all the time, even after washing. Your pores are opened out, and you have acne, and you tend to have blackheads, whiteheads, and breakouts. So those would classify you as having a oily skin. Coming to the dry skin feels rough, feels very patchy. It feels tight when you're smiling. You feel you're not very comfortable with your expressions. And sometimes also dry skin can get little itchy as well. But yeah, these characteristic features would be of a dry skin. Now, the combination skin, it's again, the center T zone would show features of an oily skin, whereas the outer would show features of a dry skin. So that would classify a combination skin. Sensitive skin, it could be a combination of dry skin and sensitive skin, but on an average, sensitive skin feels very itchy. It feels very tight. It becomes extremely oily in summers. It becomes extremely dry in winters, and there would be redness. It's just not a very comfortable skin you have. Anything you apply kind of reacts, and you cannot use the normal creams or face washes on your face because you just react to everything. Even sometimes applying fragrances or perfumes on your body, the facial skin reacts. So that is those are the features of a sensitive skin. Yeah.
Right. We see a lot of people complaining about sensitive skin these days. Is it because they are using n number of products or experiment with a lot of products? Because many times people will say that, I turn red or I develop patches immediately after, applying anything, or and their number is continuously increasing. Plus, there are people who are very photosensitive. So there are so many people with sensitive skin these types. So what's the reason behind that?
Skin sensitivity could be for very varied reasons. Sometimes it's just inherent or it's genetic. It's something that maybe kind of runs in the families. So you just have a sensitive skin by default because of your genetic background. Sensitive skin could be because of a number of dermatological conditions or diseases or disorders, I would say, which lead to a lot of dryness, following which there is a sensitivity. And then, like you already rightly pointed out, nowadays, because of the social media platforms, Instagram, Facebook, Twitter, whatever, everyone knows about everything, and thanks to Google, people have already learned a lot of things before even they come to us. So people are just randomly using any product off the shelf without really understanding their skin type. And that leads to heightened sensitivity. So maybe they never really had a sensitivity, and they've made their skin sensitive by using the wrong products, which has created a pH imbalance in their skin. Or it could be because of using products which are too strong for their skin type. Or maybe it could be there would be some skin disorder which is already ongoing and it was not treated on the right time, and then they landed up using these products to correct their problem, but then they just worsened it using them in the wrong way or in the wrong concentration.
Right. And now we would like to talk about skincare routine. What skincare routine, or what are the basics that we need to follow as per our skin type, of course. So for normal, I'm sure the skincare routine would be different. For an oily skin, it would be different.
Yeah, so I will start with the normal skin, so
Right.
people who have a normal skin, how they need to take care of their skin. So because it's a very good balance of oil and moisture, both. It's a very pH balanced skin. And I think people who have normal skin are immensely lucky. I mean, they can
They are
just,
blessed.
yeah, I would say they're completely blessed. Okay.
Correct.
But that does not mean in future it could not go wrong. You have a normal skin now, maybe in future you could get an oily skin, or you could land up getting an extremely dry skin, depending upon the weather conditions, depending upon you using wrong products and or the pollution, anything. A normal skin could go wrong at any point of time. So I believe normal skin does require care. So you use very gentle products, you make sure you use sunscreens, and also you stay hydrated, drink the right amount of water throughout the day, eat healthy, wash your face very regularly with gentle cleansers. So I think that you don't need to do too much for a normal skin, but taking care for future aversions and future issues is the thing. Now, as far as oily skin is concerned, yeah, so oily skin, so rest of the skins I'm going to come to, the oily, the dry, the combination sensitives are the ones that actually require care and on a very day-to-day basis, right? So the gentle skin, the oily skin requires you to use gentle cleansers that contain some kind of an antibacterial or an anti-acne, anti-inflammatory agent, which soaks up the oil and leaves your skin feeling dry, but not too dry at the same time. So it has to be quite pH balanced. Secondly, so oily skin, generally people think that we don't need to apply moisturizers, or we don't, because our skin is already producing enough oil. But that is a very wrong thinking and a myth and a concept. I think everyone needs to use a moisturizer. Oily skin people maybe need to use an oil-free moisturizer. So once they've gently cleansed their skin using the right kind of cleanser, and following which they can tone it up with the right toner. And people who don't have access to cosmetic toners or don't have access to the guidance for what kind of toner, I generally recommend to all my patients, just use chill water. Just spray your face right after face wash with just chill water, spritz it all over your face. It actually helps in shutting down our pores and keeping them nice and tight. So then you have lesser oil coming on your face. Following which they can use oil-free moisturizers. Again, a lot of them are available in the market, but I would recommend that you visit a dermatologist and take their guidance. So you get a right-free, oil-free moisturizer followed by a sunscreen, which is extremely important, because most of the people with oily skin tend to avoid using sunscreen because they feel their skin is already oily. They don't want to apply another layer of cream or something, but they don't realize that the UV rays are one of the, and pollution are one of the major reasons for our skin making excess of oil, especially in summers. And so we need to make sure that we are giving our skin a screen from the pollutants and from the UV rays, which will which will trigger less damage and less oil production. So yeah, that would be the last step as far as the sunscreen is concerned. And then at night, I would recommend that after the cleanser and the toner and after the oil-free moisturizer, in areas which are extremely oily, they can use some antibacterial gels or anti-acne gels as per a dermatologist's recommendation in that particular area where they get the breakouts or where there's excess of oil. That they can use at night. Now, coming to the dry skin routine skincare. Now, that is again one kind of skin which requires a lot of care, because if we don't take care of our dry skin on time and do things on a day-to-day basis, we'll end up increasing the sensitivity in our skin. Okay, also that's one thing. Secondly, because of the skin losing its elasticity, we tend to wrinkle very fast. We tend to age faster than usual with a dry skin. So caring for a dry skin on a day-to-day basis is also important. So to start with, a gentle cleanser, which has to be, and people with dry skin avoid washing face thinking, they will dehydrate or they will make their skin more dry if they use a face wash too often. But we build up a lot of dead skin if we have a dry skin. That needs to be cleansed off and replenished with a moisturizer, okay, which is not oil-free, but would have adequate ceramides and other glycerin or stuff like that, or humectants, which will hold moisture in our skin. So dry skin would involve you to need wash your face with a gentle cleanser, following which you will need to use, you don't really need to use a toner for a dry skin, but then yes, a moisturizer followed by a sunscreen. Like I said, it's for all skin types because that actually prevents from external pollution and UV rays. So make sure you have a sunscreen on, and also it will delay your aging process. So dry skin people definitely need sunscreen also. And at night, we can again use some nourishing oil or cream right after face wash so that the skin is well nourished and oil, because our skin is not making as much moisturizing factors as it should. So applying an oil or moisturizer at night before sleeping is a good way of taking care of a person with oily skin. Now, combination skin, yes, sorry. So I forgot to mention, so dry skin, people, like I said, because they make a lot of dead skin, so they should maybe once or twice or thrice a week exfoliate their skin to take the dead skin away. And also they can apply some hydrating masks on your face after the cleansing, after the scrubbing. Now, combination skin is the one with most of us. Like I said, it's the maximum kind of skin we see. And most of our patients and most of the people are confused okay, should we take care of the oily part or should we take care of the dry part? No, but you need to take care of both, because both needs, both the areas of our face need the care. So it's usually a challenge for people to, for us also, and at times people to understand what to do with a combination skin. So you need to wash your face again with a gentle cleanser, maybe with some kind of an antibacterial property. But yes, you need to cleanse your face at least twice a week with for a person with a combination skin. The center area you apply, you need to apply an oil-free moisturizer, of course. You need to apply a sunscreen as well. But at night, maybe just in the T-zone area, which is more oily than the sides, you apply some antibacterial, anti-acne gel, again, as per the doctor's dermatologist recommendation. Also, on you could use masks for the oily skin area twice a week, and maybe for the dry areas you could use a hydrating mask twice a week, depending upon I mean how much time you have or how busy you are and how much time you can take out from your schedule. But yes, using a mask for the T zone is more important, to take the oil off at least twice a week without touching that face mask to the outer areas which are already very dry. So and of course, at night, the dry areas you can hydrate with a moisturizer and see to that they stay hydrated and not as dry. Okay, so now as far as sensitive skin is concerned, most important for us is to understand that we have a sensitive skin and learn to accept it. Okay, I have a sensitive skin. I cannot use randomly any products from the shelf. I cannot just pick up this and pick up that and use. No, you need to understand that and keep your hands off products off the shelf. And please visit a dermatologist, because that's the best way to handle the sensitive skin, so that they can guide you the appropriate skincare. I wouldn't want to elaborate on the skincare for sensitive skin here, because it can get misguided. But make sure, if you don't have access to a dermatologist, just stay away from everything and just use very gentle cleansers and sunscreens for sensitive skin. That would be the best way to take care of a sensitive skin if you don't have access to a dermatologist. But please visit one if you do, because they can guide you better.
Exactly. So in order to understand your skin type, you can visit a dermatologist in case you have anything or any issue. Even buying products, if you are, not very sure about which product to buy or what to look for, please go and visit your dermatologist if, you can do that. Otherwise, for sensitive skin, as doctor have already said, please stay away from everything, and especially over-the-counter medication or products. Now, the thing is, doctor, for example, I know that I have oily skin. Again, I have, as you said, an option of going to the dermat and, consult. Or what we all normally do is run into the kitchen and go for some home remedies. Dadi ka nuska, nani ka nuska. Now, we don't understand. Either we could be allergic to those products, or maybe we are not very sure about our skin type, or it can go wrong. Now, what's your take on these home remedies? Is it okay? Or we should, again, take the advice of an expert before going for it?
So, Sayuta, like you already said, it's these home remedies are something that it's especially in our Indian subcontinent. I don't know about the world over, but in the Indian subcontinent and in India, we have this tendency of doing these nuskes at home, or maybe because of hearsay that someone did it, and so I'm going to try, and someone used it on their face, and I want to do it, and let me see and let me try. So that I think approach we need to change, and we need to change our mindset about things like that. Like we were talking about sensitive skin. So most of the times we are the reasons for creating the sensitivity. Maybe our skin was really never sensitive. Maybe it was pretty tolerant. And somehow most of the people in the subcontinent and in these tropical areas don't tend to have a sensitive skin. We have a pretty rough, tough kind of a skin. Right. But then we create trouble for ourselves. So I would advise, even if you don't have access to a dermatologist and you cannot go to a dermatologist to find out your skin type and how to take care of it, if you want to try something at home, please always do a patch test. Don't randomly just apply something on the whole face and then come back to us saying, oh my God, what happened? And please correct this. So instead of getting into that kind of a situation, do small patch tests somewhere, maybe in the lower neck, the upper neck area right below the ear area, do a patch test, see for that product creating any kind of a reaction or any kind of irritation, and then go ahead. If it doesn't, then you can maybe try it on your face. But then before doing all that, you need to understand what type of skin you have so that you don't use too drying too much of drying products on your face. So something like, basin or the chickpea flour that we call, which everyone generally uses as a home remedy for plentiful things. So that is not something dry and sensitive skin people should be using. So these are something, which maybe, I don't know, they can get guidance about this from Instagram and social media from friends. No, for this, you will need to go to a dermatologist, understand that you have a sensitive skin or a dry skin, and you need to stay off these kind of products. Even if they were used by their dadimas or nanimas, doesn't mean that it will suit their skin type. So yeah.
Right. Yeah. And, while you were explaining the skincare routine as per various skin types, you emphasized on the use of sunscreen. So for dry skin, sunscreens are available. For oily skin, you said, oil-based or other sunscreens are available. So don't avoid the sunscreen on the basis of whatever, because many times, we give a lot of excuses or, complaints we have regarding sunscreen. Like you said, it makes my skin very sticky, or it makes me sweat a lot, or that white cast is something which I'm really trying to avoid. So a number of things people put forward as reasons to avoid sunscreen. Would you like to, because it's again summers for almost most part of our country, would you like to shed some more light on the importance of sunscreen for every skin type?
I actually don't let any patient walk out of my room without having a sunscreen written out for them, because I feel no matter what kind of skin you have, whether it's normal, oily, combination, sensitive, you need a sunscreen, because as I was mentioning earlier, it's actually a screen, as the name suggests, it's a screen. It's like a barrier for our skin, which from pollutants, from UV rays, from dust, pollen, lot of things. So it's something that I think everyone should be using, and people who are outdoors definitely need it more. But even if you're indoors, I don't think you can skip sunscreens, or you should skip sunscreens, because our gadgets, our microwaves, our laptops, television screens, everything emits UV rays in some form or the other. And so I think we just need to be, UV rays prepared right from the start of the day, whether you step out or not. So it's something that's should be done 24/7. It doesn't make a difference which time of the day it is. So that's one thing. Yes, the kind of sunscreen we use could vary depending upon, we have a sensitive skin, then we need to use a different category of sunscreen, which are more physical and which don't have chemicals in them, which have more physical barriers like zinc or titanium. So which are more easily acceptable, and they don't sit inside the skin or penetrate in the skin and create a kind of a reaction. So sensitive skin definitely need to use more physical sunscreens than the chemical ones. Now, the oily skin people, when they choose a sunscreen, they need to make sure that the label says that it's non-comedogenic, or it's oil-based, water-based or gel-based. And so these two criteria definitely need to be noted by people who are having an oily skin. For a normal person with a normal skin or the combination skins, also they need to use sunscreen, which would be used by people with an oily skin. The same thing. They need to make sure that they're gel-based and that they're non-comedogenic, so that at least the oily area is not further hampered and makes more oil, or creates blackheads or acne, triggers out acne. And people with a normal skin are lucky. Like I said, they are blessed. They can use any kind of sunscreen they can get hold of, but they need to use a sunscreen. That's the punchline.
Right. I'll quickly take some of the questions that viewers are asking. So Abhishek Sen is here asking, how can I avoid wrinkles?
Wrinkles are something that are part of our aging process, and we age right from the day we are born. We are aging every single day, and the skincare for aging or anti-aging would be a day-to-day skincare. most important. I think we can never stress on that enough. If you take care of your skin on a day-to-day basis by using sunscreen, by using, if you have a dry skin, using a moisturizer, you will definitely wrinkle less. But then if you already have wrinkles and you want to take care of them, then you need to visit a dermatologist that they can guide you as per your skin type. What would be your what would be the right anti-wrinkle or anti-aging treatment for you? And so it's a common myth that retinol takes care of all our aging. It smoothens out our skin, but it's not. It doesn't hold true for everyone. There are plenty of patients I know who don't accept retinols very well, and they'll end up actually creating even more aging and more sensitivity. So yeah, the guidance by a dermatologist would help. But in case if you do want to try a retinol, make sure that you do a patch test of any retinol that you pick up and start with a lower percentage of retinol and then gradually take it up to a notch higher. But yeah, that retinols are generally the safest option if you want to try it at home, and make sure that you do a patch test, please.
Right. We have a lot of viewers who are concerned about their sensitive skin, and they have almost similar questions, though you have already addressed it. But still, because so many viewers are here asking about sensitive skins, like how should I handle my sensitive skin and uneven skin tone? What's the best way to handle sensitive skin? Again, anything in particular that you would like to tell them?
So, sensitive skin, again, requires a lot of care. And in that, it requires lot of precautions. We need to know what not to do when it comes to sensitive skin, what not to apply, what we need to understand that we have a sensitive skin, and we need to hold our hands back when it comes to applying randomly any products on the face. So using the right products with maybe some desensitizing medication, which could be suggested to you by your dermatologist, and they will help you in applying the right moisturizer, which is pH balance, and which further would not heighten your sensitivity, but would keep it under control. Because there's no way we can take the sensitivity out of your system. It's just there, but we can help you regulate it, keep it under control, so that you are more acceptable to other products if you need to apply them to maybe as an anti-aging or brightening, skin brightening, or reducing the pigmentation. So maybe visit to a dermatologist for a sensitive skin would be the best idea. But in case you cannot visit or you don't have access, make sure you use gentle stuff, and always please do a patch test before applying anything on your face. A patch test could be done for the cleanser, for your moisturizer, for your sunscreen, everything. I think a patch test is a must before anything is applied on the face.
Right. Before we sum up, doctor, there are two more issues that are very common with people in our society. One is acne, one is pigmentation. How to, deal with them?
So coming to the acne part of it, so acne is like a big discussion or a chapter by itself. I think I could have another YouTube session on that, but it's one of my also favorite topics. It's very close to my heart. But acne means that doesn't always mean that you have an oily skin, so you're getting acne. Acne happens for varied reasons. It could happen because you use wrong product which blocked your pores, or you use very heavy moisturizers which blocked your pores, or you are using, so people tend to apply oil and sleep overnight. That could create oil acne and oil folliculitis, as we call it. Or so these are reasons which we don't realize, and then going to saloons and getting the facials and done facials or massages done for the face, so that can also trigger acne, because the pores tend to stay opened out, and after which the creams and oil which they apply, they sit inside the skin and they create trouble and create acne. So acne can happen for varied reasons, other than the genuine reasons for which acne happens. So that could be hormonal reasons for you getting acne. And hormonal, again, is multifactorial. It could be a PCOD, a polycystic ovarian disease condition, or it could be a mid-age acne because of your mid-age hormonal issues. So acne has varied reasons. I could endlessly discuss acne, but you need to understand acne means your skin is really choked or blocked. There's some pores which are not breathing. Some pores are making excess of oil. So use a cleanser. Wash your face very, very regularly. Once in the morning, once at night. Use oil-free moisturizers. Try and use some anti-acne products which will help in drying out the acne and minimizing the pigmentation or the scarring. And do it as early as possible. Don't wait for the acne to blow out of proportion and then which will again leave a lot of pigmentation and scarring. Try and address it at its early incipient stage, so then we can help it treat faster or clear it out faster. But yes, again, please visit a dermatologist. They are the best people who can guide you as to what kind of face washes, if you need any oral medication supplementation for treating acne also, or you could maybe just do away with some kind of cleansing routine will help you in keeping your acne out, or if there are some hormonal issues which needs to be addressed, or if something you're doing wrong in your routine which is creating the acne. So I think those questions or that kind of treatment you can only get from a certified dermatologist. Yeah, right. Not from hearsay.
Right. And what about pigmentation? How to, avoid them, or what to do?
So pigmentation, it could be again for varied reason. It could be because of extreme sun exposure, we can get tanned up. That's one of the most common reasons. Being in living in a tropical country, we tend to get a lot of pigmentation and tanning because of just sun exposure and us not using sunscreen. So the basic treatment for any pigmentation would lie in using the sunscreen. Most of the time, just getting into a good sunscreen routine, applying it at least twice a week. If you're twice a day, if you're outdoors, then at least twice a day, once in the morning and once again around 1 o'clock, you apply it. So a sunscreen application actually can prevent pigmentation to quite an extent and also help us in our future anti-pigmentation treatments. And depending upon what kind of pigmentation you have, you could take guidance from, again, a dermatologist who will tell you and guide you the right kind of medications for that particular kind of pigmentation, because there is no one anti-pigmentary agent for our melasma or which we call as chaya or something that has a different treatment approach. And whether, first of all, would it be just treated only by medication and applications of creams, or would we need to do something more intensively for them? So depending upon the reason for pigmentation, the approaches are different, but it starts with just by using a sunscreen on a very, very regular basis.
Fair enough. And Doctor, quickly, would you like to say anything before we sum up?
See, it's my standard line to all my patients and generally who ask me about skincare. Two things. One is, please understand what not to do. You need to understand, I need not do this. This is not for me. I need not apply this. This is not for me. So you need to understand what not to do, because that saves you from a lot of troubles in future. And secondly, please invest in your skin. It's something that's going to stay with you for the rest of your life, from the day you're born till you finish off in life. It is there with you. So the more you take care of it on a day-to-day basis, by using the right kind of skin products for your skin type, actually goes a long way. So, and you have any issues, please don't do hearsay treatments. Don't go to Insta, don't go to Google. They will definitely land up giving you a lot more hype or more treatment options than what you actually need. So visit a dermatologist who's certified to guide you for your skincare.
Fair enough, Doctor. Thank you so very much, Dr. Roma Pandhi. It was wonderful talking to you. Your valuable guidance, as I'm sure, your guidance will help our viewers. Thank you so very much once again.
Thank you.
And viewers, thank you for watching this session. And for those who want to get personal consultation from Dr. Roma Pandhi, you can consult her at Pandhi Hospital, Chandigarh, or you can also visit Insta or Facebook by the same name, Pandhi Hospital, Chandigarh. Thank you. Have a great day ahead. Goodbye.